Hi everyone, welcome to another episode of Before and Beyond. And today we're going to talk about an onlay case. So an onlay is essentially like a dental crown, but instead of covering the whole entire tooth all the way down to the gums, we actually just remove and reshape the top part of the tooth and add the same type of material as a dental crown, which is usually ceramic, zirconia, that goes on top of the tooth, of the tooth, and that's why it's called onlay. And then we can glue it on. And the longevity of an onlay is actually very similar to a conventional dental crown, and usually lasts about 10 to 15 years. Now, the onlay also provides protection for the tooth underlying it to prevent it from breaking. All right, so I'm going to talk to you about a step-by-step approach of how we actually plan for an onlay and how we actually executed the whole entire treatment plan as well. Okay, and so the biggest benefit of having an onlay done compared to a conventional, traditional dental crown is that we do not need to trim so much tooth away, and therefore we have a lot more tooth left for something in the future. For instance, if the tooth still has tooth decay in the future because the patient didn't clean well, but because we didn't trim a lot of tooth in the beginning, means that we can then convert to an even bigger onlay or change it into a traditional dental crown. So there's a lot more ways we can extend the longevity of the tooth itself. Okay, so I'm going to talk to you more about how we actually plan it out. So over here, you can see this is a very this a patient saw this, so came and see me, and you can see immediately that there's quite a number of things happening here. So you can see big filling over here. So you can see a big filling over here. You can see over here is actually a dark shadow, and on the X-ray itself, there was tooth decay over there as well. So we are looking at having tooth decay here and tooth decay here. Okay. So when tooth decay is here and there, there's a very high chance that this tooth, this part over here, is going to fracture off very easily, or this part here is going to fracture off very easily like that, because once the decay or the filling becomes more than 1/3 the width of the entire tooth, so if it's 1/3 of it, 1/3, it would most likely weaken the tooth and cause it to fracture in the future. So having something to cover the tooth protects the tooth from breaking. So an onlay is required, and I'll explain to you why, how the onlay actually prevents fractures. Okay. Of note is that onlay is usually used interchangeably with dental crowns. It's just how we plan the tooth and how we reshape the tooth. And it's usually easier for patients to understand if it's a dental crown. But if you're going to specifics, an onlay rests on top of the tooth, whereas the dental crown goes around 360 degrees around the tooth to and goes down all the way down to the gums to cap the tooth. Okay. So, for lack of a better word, an onlay is also called a partial crown. And so we decided to go with an onlay over here. And so this is what we're going to do. We're going to go and first of all, what we did was we actually trim the surface of the tooth. So we remove the surface of the tooth because the onlay needs a certain thickness, and that thickness is usually about 1 to 1.5 mm of height. And so once you remove it, you can see better the underlying tooth structure. So you can see over here, there's something's happening. The first thing you can see is happening is that there is decay. Like I said, around here. You can see the dark shadowy parts over here. Okay, there's spreading, right? So that means there's secondary tooth decay. That means there's decay underneath a filling, all right? And you can start to see hints of an area here, hints of decay over here as well. All right, can you see that there? And that is starting to show only. Okay, but from the X-rays, and that's why X-rays are really important. We know that it's a big hole. All right, so we need to fill that up. All right, so this is what we did. So we removed that. Excuse the blood, but you can see that we start to remove the decay, and we start to remove the old filling, and start to open the area up, and you can see that, hey, there's quite a bit of decay here. You can see that there? There's quite a bit of decay here starting to go in. When the dentist does it, you will feel a significant drop of resistance because there's a big hole underneath, like an undermined hole underneath it. And so we know there's some tooth decay here, quite a bit of tooth decay here. We start to remove this filling as well. And there's a big black area here that we got to clean. The blood, actually, we didn't really do much, but the blood started to pour quite a bit. And that's because there's the hole underneath, there's the cavity, underneath the tooth has a cavity that has caused food to get stuck inside and caused the area to be very unclean, that that when we started to touch the gums a bit, it started to bleed a lot, and that's why it has this issue as well. And interestingly, you can see that there's things around there, so some food particles here, or maybe even a hair follicle there, hair particle over there that is collecting because of how food gets stuck there. You can also see that there's a over here, which will be more indicative, more apparent later on when we start to break down this case, that there's a bit of a shadowing over here. Okay, and you can also see the tooth itself. Let me change the color. The tooth itself, it's concave here. Okay, I hope that's more apparent. And naturally, the tooth is actually like that. Okay, I hope I can see it. Everybody can see it. And what has happened is that essentially there's a divot caused by the dentist, the previous dentist trimming doing the filling, and the dentist has tried to fill up over here like that. So this is man-made, where the filling was trimmed. The filling over here on this tooth was done, and while it was being done, the tooth at the side of it was unintentionally trimmed as well. So what has happened is that there is an area that is gone from a convex area, it has become concave, and the dentist then filled up the filling up to here. Okay, so what has happened is that is an unnatural spot that food can get stuck there because it's not totally flush. The contact point is not nice and flush with the tooth like that. Okay, so let me just remove everything. So essentially, instead of the contact point being like that, like nice and clean like that, it has gone into going here. Sorry, it has gone into here, and then the filling just bulging out like that. Okay, so that's why food gets stuck inside. There's decay and things like that in the future. All right. Anyway, so so the consensus was made to continue on. All right. So I just want to show you what we see in when we start to build up this case. All right. Now the decision also was made for this tooth, the premolar, which is this tooth over here, to actually monitor, because on the X-ray it didn't look significant, and also at the same time, when we started to go on ahead, it wasn't. It looks like it could still be cured. Cured. What I mean by cured is that it could mean that the area can be remineralized again. So the concessions were made with the patient to first do the onlay, and then for this tooth over here, we'll monitor it, and we might just do the filling as and when is needed. Okay, so we are keeping in view a filling over there as well. So I just want to be very clear on that. we did look for it. So you can see over here, this is a bit more apparent. And I can show you now that when we are looking at this particular tooth over here, you can see there's a big decay. So we clean up the area. We use some sand to clean up the area as well. And you can see that we remove all the decay. And you can see the hole is quite large over here. The hole is quite large over here. That is because of the decay. And so now we know why, hey, the filling didn't look so bad, right? But now we know why we need to do an onlay to protect the tooth. It might fracture, okay? Now we can also see over here that this is the area. This is the area that has a possible sign of decay, and you can see the divot that the previous dentist has already created. Now, I'm going to monitor that, like I said, and I'm going to do a filling over there in the future if I need to, okay? So I'm always trying to err on the side of trying to see if the decay can be gone by itself. And if it's so, great, I don't need to do a filling and the patient doesn't need to do a filling. But if the decay goes into an irreversible stage where we cannot just wait on it to grow, to cure itself by remineralization, then we need to go in, and that's when we have to do a filling for that tooth, okay? All right. So onward we march. What we then did was we actually did a filling over there. So we then did a filling. Can you see this entire part was filling, and this is what we in dentistry we call it as a core buildup. So this is a core buildup. So you're building up the core over here. So these are all core. It's a core buildup over here, and that's filling material that we use to build up a little dome around the tooth, so that the filling material acts like an insulation that is near, because if we didn't do this, it's very near the pulp already. It's really near the nerve of the tooth, and having the filling there provides some insulation for the tooth, so that the nerve doesn't get agitated before the crown. At the same time as well, we make it a dome shape so that you can relieve certain pressure points when we put on the crown. Okay, so we did a filling first. We clean up the area. We did a filling first, and this is how it looks like. Now we then we scan the case in, we scan the teeth in, and then we then design our crowns. Okay, so I'm gonna just show you our crowns very soon. Just hang on a minute. Let me just turn it off, and let me just go on over here, and I'm gonna just show you a quick one of how we actually design a crown in our lab. So here we go. So all right, so over here this is over here this is how it looks like. I'm going to show you how the a crown looks like, but essentially what you're looking at is a video of how a crown is going to be. So just give me a minute. So you can see this is how we digitalize it, and this is how it looks like. So you can see over here we are actually making a crown. All right, and so we are digitally making a crown, and then we can fabricate it using our technologies over here. This is how it looks like, and we basically make sure that the tooth looks and feels like your natural tooth. We are looking at the grinding patterns so that it doesn't feel abnormal when you're chewing or biting down, and so we are making sure that these are all done beforehand before we actually produce the crown. So when you get the crown in, it's a lot more comfortable, fits your teeth, doesn't have food getting stuck there, fits your bite as well. Okay, so so that's how it is. And then once we're done with this, before that, so you can see over here, this is a mark of an onlay. Okay, the mark of an onlay is that is that the mark of an onlay is that, let's try to clean up the blood. The mark of an onlay is that when we look at this area here, the top portion is essentially intact. All right, so an onlay doesn't go all the way down to the gums like what I've mentioned. It just goes where it needs to go, where the material is thick enough, where the material is strong enough, and where the material is retained in the on the tooth. Okay, so the benefit, the true benefit of having an onlay is that we save a lot of tooth, and we do not trim the tooth at the base to the base. And when we do not trim to the base of the tooth, what that means is that it strengthens the tooth a lot. All right, or rather, it doesn't weaken the tooth a lot. What happens in the crown is that when you trim to the base of the tooth, it's like the collar, right? It's like the neck of the tooth. There's a higher chance that it might like break because it's a lot more. It's nearer to the bottom of the pyramid. Okay, if we just only trim the top of the pyramid, what that means is that the base is still firm and strong, and so the tooth doesn't break, or is unlikely to break, because the forces are only on the top. So I'll illustrate this later on with a picture. But essentially what I'm trying to say is that with an onlay, you're protecting the tooth for longer, and the tooth has a less chance of breaking in the future. Okay, so we're gonna go on. Then we look at this. So once we do the trimmings ready, then this is just showing from the side. Then we take the color of the teeth to make sure that the tooth blends in well. Okay. Oop. All right, and maybe in about 3 hours time, we'll get back. So in the morning, what happens is that we usually do about 1 hour first to trim and reshape the tooth. Okay, and remove all the decay, reshape the tooth. In 3 hours time, during the 3 hours, we send this to our lab, and I'll see you after that to actually glue on the onlay. Now, this is what I get back from the lab. They 3D print the model of the shape of the tooth. All right. So it looks like this. We 3D printed the shape of the tooth. And then after that, we also have the crown fitted, the crown already made, and we fit this onto the model itself, on the 3D printed model itself. That way we make sure that it fits nicely. Okay, so this is a crown that we made already. This is a ceramic crown we made, and then we fitted on top of the model so that it fits really well. Okay, so this is from the side. Again, what I'm trying to say is that we're trying to make sure that it fits snugly on top of the tooth, okay, but we preserve the base of the tooth a lot more. Okay, all right. So I'm gonna just explain more about, since this picture is pretty clean. All right, I'm gonna explain to you a crown and a crown and an onlay, the physics of it, I guess. So if you have a look at a regular tooth, so I'm gonna just draw a regular tooth. Okay, so this is my bad drawing, guys. I'm sorry. Okay, and this is the gum. Okay. Now, a regular. Oh yeah, I want to draw the nerve as well. So this is the nerve. Okay, so this is the nerve. All right, try my best to draw, guys. Okay, so this is the nerve, right? Okay, so obviously we don't want to touch the nerve, all right? And the nerve supplies sensation, blood supply. Sorry, the nerve. This is a pulp, so it supplies nerve and the blood vessels to the tooth. Okay, so when we do a crown, okay, essentially what we are doing is we're trimming the tooth 360 degrees here. Okay, and then this is going to be glued on. This is the crown, right? So the crown, what I'm trying to say is that the crown goes all the way down to where the gum is, okay, and is glued on, okay. So now if the dentist was a bit heavy-handed, it will grind a bit more here. And the reason for the crown in the past is that materials in the past doesn't really chemically glue well onto your tooth, because the cements were really poor, and at the same time the material itself is more inert, like gold, for example, that doesn't really chemically glue onto the tooth. And so because of that, a lot of the dentists, the science behind the crown was to get as much surface area as possible to be able to grip the tooth so that it doesn't drop out, because the material was poor, and also at the same time the cements were poor. And don't trust me, you do a lot of crowns, and so but with technology, what has happened is that there's better cements out there, there are better materials out there that allow us to reliably reliably bond or chemically glue something onto your tooth. And when that happens, it's like gluing onto the wall. You don't need to have so much grip onto the wall, it just sticks on, right? And like, let's say you glue on a hook, right? The hook can hold like 5 kgs worth of your painting, right? You don't need so much surface area to be able to get a nice retention, all right, of your crown. So because of that, it changes the physics, it changes our thinking a lot. One of the downsides of having a crown done is that we are trimming down to the base, all right? And when we trim down to the base of the tooth, there's a higher fracture risk, because we are trimming down over here. The base over here and over here is a lot more thinner. So let me just draw that again. The base over here and over here is a lot more thinner. There's a higher chance that it might break. All right, and also at the same time, when we trim down to the base, this is nearer to the nerve. So therefore, there's a higher chance that there is root canal problems in the future. Okay, so we're going to try to avoid that. And the third thing that is not good with a crown is that if I did a crown already, and for example, there might be some tooth decay over here, all right, or here, all right. I'm forcing myself to replace the crown, and the more times I replace the crown, the more tooth structure I remove, right? And eventually there will be not enough tooth structure left anymore, that we got to remove the tooth. And so having an onlay there reduces the amount of tooth structure that we have to remove at the start, therefore prolonging the cycle of the tooth. Okay, so I'm going to just draw for you how an onlay looks like. So let me just remove that, remove this, choose a color, let's choose pink. And so an onlay essentially goes just like that. Okay, so it's the same thing on the top, but it goes like that. Okay, what that means is that we then don't need to trim so much tooth away. So we don't need to trim so much tooth away. All right, and so therefore the distance at the base is a lot more thicker, right? So what that means, the base is more thicker, there's less chance it might fracture. All right, the tooth fractures, right? Less is further away from the nerve, therefore there's less possibility of root canal problems. The third thing is that we are also extending the longevity of the tooth, and I explained that a lot already. Now the downside to having an onlay is, I think we already saw that just now, is that this portion of the tooth, let me just change the color again, I know I'm running out of colors. this portion of the tooth, oh, can you see that? This portion of the tooth, yeah, you can see that now. It's natural tooth color, natural appearance. All right. Whereas this part is onlay appearance. All right. So the difficulty comes that it might not look and blend 100% because it's like an artificial material to a natural material, right? And so there are ways to blend it better, and our technicians are really good. Our ceramists are really good to blend it as well, but it's not going to be 100% if you look very closely. That's what I'm trying to say. To circumvent this, we can do a hybrid. So a hybrid would be, we save tooth here, but we extend your crown all the way over here where it's more obvious, right? And so therefore this part over here is onlay appearance, and so it looks natural because we are covering all the way down to the gum. So it doesn't look, there's no contrast, so it looks better in that sense, right? And so these are the two significant downsides. Basically, this is one of the significant downsides is to actually the fact that there's a change in appearance. The second significant downside is that it's a lot more technique sensitive, because if we are relying on chemicals which is essentially the glue, to glue onto the tooth without much surface area, it means that we cannot afford to have any contamination on top of the tooth. And therefore, we have to do this. We have to put a rubber frame on top of the tooth. And the rubber frame is called a rubber dam. The rubber dam is there to isolate the tooth from any saliva, any blood, any contamination that might affect the bonding or the gluing process of our onlay. Because anything that can contaminate the gluing process will risk the onlay from dropping out prematurely. So this is actually the very critical part. It's very technique sensitive that a lot of dentists need to really make sure that they do well if they're doing an onlay. Okay, but before that, we got back the onlay already. We tried that in the mouth. So this is before we bond it in. We tried that in the mouth, and you can see a color difference. You can see that over here there is natural tooth color. Natural tooth color over here. Natural. And then this is artificial, right? So this is the onlay itself, right? Artificial, right? Artificial appearance, right? And so there is a difference in appearance, all right? So I wouldn't recommend this onlay procedure for the front tooth because there will be a mismatch. So front tooth, I usually have to remove the whole entire layer on the front to cover up the area so that it looks nice. But from the back, as long as from afar you don't really see it, I think we can deal with that, and the patient is happy with that, it's fine. There are some patients of ours that are really particular about it, and so we did the hybrid method where we cover the whole entire front surface of the onlay, but at the back surface we can be halfway because nobody sees the back surface of the tooth. Okay, and then we isolate this area with rubber dam, keep the area clean. We then use some sand to roughen up the surface, clean up the surface. The sand is essentially to make sure that the surface is as fresh as possible, as clean as possible. Okay, and then we use some, this is like a conditioner, it's an acid conditioner that we then use and flow around there to make sure that we can, the acid actually just etches the tooth, keeps the area clean so that it looks good. And then finally we then glue on top of use the onlay and we glue on top of the tooth. And then this is just some cement coming out. Okay, so we glue it on under very clean conditions so that it can it can glue on really well. And you can see that there are a lot of characteristics done by our good friend in the lab, our ceramist, that actually puts a lot of stains on it as well. You can see that over here. You can see that he can be very, very natural because we try to put a lot of whitish. This patient has a lot of white patches, and so we actually put some white patches on top of the tooth to make it and mimic somehow of the tooth itself. Okay, so Onlay is a very viable option for us, and you can think about having it if you feel that your tooth is really broken down. Maybe talk to your dentist about having an onlay treatment done and not doing a dental crown, and see whether it's a suitable fit for you as well. Thank you so much for listening today, and I hope you enjoyed this episode. Cheers.